I was I was walking 6 hours after brain surgery. I was discharged straight from ICU to home 24 hours after brain surgery. Like even the physical therapists were like, this is not normal. And I think it's also a testament to preparing your body for
Right.
any surgery.
Right. That's that's more of I was gonna say that is, we have a book coming out about the process I run Sharp. And whether it's reading like a book like Stephen Covey's, 7 Habits, like you have to be proactive. You're talking about being proactive and prep versus reacting, which is, unfortunately, too many people are always reacting. So they're always backpedaling and trying to deal with the next set of events. And, your preparation certainly has led, to a much cleaner, efficient recovery. And that's why the providers are, confused. Like if you look at our history of surgery, how much has surgery changed? There's been changes, technical changes, advances, microscopes, instrumentation, patient, a person who's got a lot of inflammation, not healthy, lots of risk factors, they're always going to have a tougher time. The classic, as you know, nobody in my practice gets fed strange snacks after surgery, no jello and odd things.
I really appreciated that.
Yeah, it's, baffling, Cheez-Its and like whatever other
Gatorade,
Gatorade, yeah. So, we give people coconut water and we have like this little basic gluten-free,
crackers.
so, it's just strategically you have to understand and ask why. And then obviously when you don't know something, it's hard. Like that,
Mhm.
that's all that trust factor that you're mentioning. People are like super distrustful now.
Yeah, I see that often.
Well, you did brain surgery, and I kind of knew you for a period of time before you ever came into our practice, and you needed some time, obviously, to recover. And that's got to be such a huge thing to recover from. And then I know you felt better, but just like mentally, it's got to be
Mhm.
a very big deal with your little ones and your husband, who's obviously paramount to getting everything organized and helping. So I guess that period between the recovery from that and then your next step is when you came to us in Austin.
Yeah, that's where you come in. So, and people, when I shared, it was one of those things about like, I had a consult with you. So, just to give everyone context, I had brain surgery February 1st, 2023. And I had a consult with you, Dr. Whitfield. Gosh, it was maybe June. It was like 4 to 5 months after brain surgery because I was like, I want these out. Obviously, I had to prioritize the brain surgery. And I just like had so much peace. I was like, this is my guy. And I remember doing a Zoom consult because I'm, don't live in Austin. I'm a couple hours away. And I kind of told you my story. And I was like, so, when would you be willing to operate on me? And you're like, when you're ready, we can get you scheduled out. And I had told you kind of briefly Spark Notes version of my brain cancer story. And you were like, yeah, I guarantee you your natural killer cell function's suppressed. And I was like, wait, how did you know? Did someone send you my labs? And you were like, no, I got a feeling. And I was like, this is my guy because you hadn't seen my labs and you knew and you just understood. That's where a lot of things, I think a lot of surgeons just, they do the procedure, but as you know, in your team, and that's why I obviously chose y'all, it's so much more than just the surgery and just the follow-up appointment. It is, what do you do before? How do you get your detox pathways open? How do you decrease inflammation? And then this procedure itself, and then the recovery, which we can talk about. But so I knew I wanted to do it, but brain surgery recovery, even though I didn't have to go to speech therapy or occupational, I was technically cleared 2 weeks after to drive. I wasn't on seizure meds, steroids, pain meds. I had a pretty kick-A recovery. But with that being said, my body, my nervous system needed time to heal. And so my doctor in California was like, yeah, you need them out. This is part of your healing, even from cancer and getting your immune system ramped up. But she said, you have to wait a year. And I was like, no, I don't want a year. That's so long. But at looking back, it is exactly what I needed. Just personally, I'm not saying everybody needs that between two surgeries, but brain surgery, the way that it affected my nervous system, I was having issues sleeping and just, it's a difficult surgery.
I'm glad you brought up sleeping. That has to be one of the things that's really thrown off with that surgery. I know people probably underappreciate what I'm saying, but you can emphasize that because you can't recover without sleep.